about this as well. I would like to introduce you to our panel presenters, and I'm going to hand it over. So everyone's settled in. Let's get this important conversation started about direct support professionals. Addressing the workforce crisis facing the disability system is a top priority for advocates, and you've heard a lot about it yesterday and already today. Without further delay, I want to introduce nationally recognized Robert Espinoza. He's Executive Vice President of Policy for PHI. Robert oversees National Advocacy, Research, and Public Education Division on the direct care workforce. In 2020, he was selected for the first ever Care 100 list of the most innovative people working to reimagine how we care in America today, and as one of Next Avenue's 2020 influencers in aging. Last year, he testified before the House of Representatives, the Committee on Education and Labor, on the need to improve funding nationwide for workforce interventions in direct care. And then when Robert finishes, we're also going to hear from Pat Hornbecker, who is a parent of a child with developmental disabilities and the president of the ARC of California Board of Directors. Then Kristen Pederson, who is executive director of the ARC of San Francisco. And then Tori Trentacoste, who works as a direct support professional for United Cerebral Palsy of the North Bay. I'm excited to have this great perspective, these incredible presenters with us. Robert, welcome, and I'm going to hand it over to you to kick us off.
Thank you, Jordan, and thank you everyone associated with this event today for inviting me to speak. As luck would have it, I have a severe cold, so you may be hearing a little bit of scruffiness in my voice. I apologize for that. I'm just going to take a moment right now to share my screen. So just give me one quick moment.
I've got you covered, Robert.
Oh, you do? Okay, never mind. Gotcha. Let me just step out of. Okay. So just by way of introduction, my name is Robert Espinoza, and I'm the Executive Vice President of Policy at PHI. Next slide, please. For those of you who are not familiar with PHI, we are a national organization that's focused on strengthening the country's direct care workforce. We do that work through research, through advocacy at the federal, state, and local level, and through designing a range of workforce interventions in direct care, such as training programs, advanced roles, and a variety of other strategies, including recruitment and retention. We've been around for more than 30 years, and we're often considered the nation's leading expert on this workforce. Next slide, please. Just to set the foundation for this presentation, our research does show that there are about 4.6 million direct care workers in the US. By definition, we define direct care workers as home care workers, residential care aides, and nursing assistants who support older adults and people with disabilities in a variety of long-term care settings. They work in private homes, they work in assisted living and other residential care settings, and they work in nursing homes. One important statistic that I want to share related to this stat is that already the direct care workforce is larger than every other occupation in this country, which gives you a good sense of the demand for these workers. Next slide, please. Because these jobs are growing at such a high rate, and because many workers are often leaving direct care for other sectors, we estimate that there will be about 7.4 million job openings in direct care that will need to be filled in the next 10 years. Next slide, please. These are 7.4 million jobs. These account for both new jobs that are being created by growing demand, but they're also jobs that are being created because direct care workers are increasingly leaving direct care for other fields, like retail and fast food is two examples. So the question I think for all of us to grapple with is how will we fill these job openings in direct care unless we improve the quality of these jobs? Next slide, please. So today's presentation is based in many ways on PHI's signature report on the direct care workforce. This is a report that we released in January of 2021. It's called Caring for the Future, the Power and Potential of America's Direct Care Workforce. And it's a report that we issued to provide the field, the long-term services and supports field around the country, a framework for understanding who these workers are, a historical review of what this workforce has undergone in terms of changes in its composition and the kind of challenges it's facing over the last few years, and also a framework for recommendations. How do we improve these jobs across both policy and practice? And I'm going to speak to that framework in today's presentation. Next slide, please. The first part of our framework is about financing. When we think about improving direct care jobs, it's important for us to remember that in many cases, the quality of direct care jobs is being dictated by the financing behind it. And oftentimes, it's Medicaid as the primary funding source. We argue that in order to really improve these jobs and strengthen both recruitment and retention, we need to think about the financing that's behind it. And so one of our primary recommendations is, of course, to protect and strengthen Medicaid in all the ways that we can, since that is the primary public payer for this workforce, but also to think about alternative payment mechanisms. I know that many states around the country, including California, are considering options such as creating a state-based social insurance program that would cover long-term care. This is the kind of program that would make long-term care more affordable to people and would require people to spend down their assets or their income in order to qualify for Medicaid. But these programs can also be designed in such a way that they would improve jobs for direct care workers. So we think it's important to really strengthen the financing in order to improve these jobs. Next slide, please. The second area that we look at is compensation. Our research shows that the median wage for direct care workers in this country is about $12 to $13 an hour, and it's a wage that has not improved much in the last 10 years. Unfortunately, these wages do keep workers impoverished, and because of low wages and many other conditions, workers often leave the sector for other fields. So we would argue for, of course, ensuring that compensation is at least a livable wage. Next slide, please. One more slide, please. So this is a chart that shows the median hourly wage for direct care workers, because many direct care workers are relegated to part-time work, either by the economy or their employers. We show that about 53% of workers are living in or near poverty. And because of low wages and other conditions, the turnover rate within the sector tends to hover within 60 to 90%, often within the first 90 days. So direct care workers are leaving the sector in droves, really. Next slide, please. We would also argue that for years, I think what was needed was a livable wage. And yet what we're seeing around the country is that it's become increasingly competitive for long-term care employers to compete with other industries. This is a slide I took from a presentation I saw recently at Leading Age in DC, where they showed that Buffalo Wild Wings was actually hiring workers for about $25 to $35 an hour, and Burger King was offering, I think, a $1,500 signing bonus. This is just the landscape of what employers are facing. This is an example of the kind of challenges that employers are facing, that oftentimes industries like fast food and retail are better able to compete for the same candidates. Next slide, please. A third area is training, and here we would talk about two areas. The first is making sure that the training requirements for this workforce are as strong as possible. In other words, that direct care workers are being equipped with the right skills, the right knowledge, and the right confidence to succeed in these roles. The other piece is the delivery systems. Too often, even if the training requirements are strong, and they're not often strong, the delivery system itself also needs work. So for example, the training system might be outdated. It might be increasingly relying on technology, and yet the technology may not have been vetted for accessibility or for impact. In many cases, the modalities that training providers are offering are not abiding by adult learner standards, or not really equipping workers who might need experiential or hands-on systems to really be able to learn the skills on this job. And so we would, of course, argue that the training standards and delivery systems need to be as strong as possible. Next slide, please. Washington State, we believe, has one of the best examples of a strong training and certification system for home care workers in particular. One of the issues that they address that I think is innovative in this country is that they're training personal care aides, which are often the most undertrained segment of this workforce. These are the workers in the direct care workforce that do not offer the same kind of clinical support as their colleagues, as their peers. They also have a certification system, so workers and employers can be guaranteed based on that certification system that their worker has already undergone the requisite training. And I think that's a real model for the rest of the country. Next slide, please. Another area is about looking at how do you fund, implement, and evaluate a broad range of direct care workforce interventions. These are interventions related to areas such as advancement opportunities or universal worker models, which is a model that has really been tested in parts of California, or recruitment and retention strategies. What are the best ways to find and keep workers in ways that are innovative and effective? As a policy suggestion, one of the things that we've been seeing is that many states are proposing kind of innovation funds, so a set amount of money that their state can offer to providers in the field that allow them to design and then test whether these interventions are working. So it really puts the innovation in the field and allows people on the ground to innovate. And I think it's a good way for us to think about this work. Next slide, please. Oh, this is a great example. So in Arizona, Mercy Care is a managed care provider that developed an innovation fund where they provided, I believe, $1 million total for all of their providers in their managed care plan to innovate approaches to strengthen this workforce. And as part of their relationship to these providers, they provided the money, people put in proposals, and then these proposals also evaluated the extent to which these ideas worked, and of course the extent to which these ideas could be replicated and brought to scale. Next slide, please. Minnesota has a direct support connect registry. This is a caregiver registry, or what we would call a matching service registry. These are online platforms where workers and consumers can find each other based on preferences, needs, and availability. So there are about a little more than 10 statewide matching service registries around the country. Too often, unfortunately, these registries are not as kind of tech savvy as they could be, and they're not as developed as they could be to really meet workers and consumers. And they're certainly not in all parts of the country. So this is a great example of how a state can really innovate for both workers and consumers. Next slide, please. Another area is improving direct care workforce data collection and monitoring. Too often we see that states do not collect proper data on direct care workers. They do not collect the number of full-time or part-time workers, data on turnover rates or vacancy rates, or turnover on compensation or training certifications as other examples. And so here we would argue for the importance of states really boosting their data collection infrastructure to collect data on those minimum data set variables that I just discussed, but maybe even going far and beyond and looking at issues such as disparities as one example. Are all workers within the direct care workforce succeeding at the same level? Or is it that women and immigrants, as two examples, may be faring worse than their counterparts? Next slide, please. In Texas, we worked with the Department of Health, I believe, to strengthen their workforce reporting requirements and ensure that, I believe, their Medicaid-funded providers would collect better data on those minimum variables that I just mentioned. Full-time and part-time staffing, turnover and vacancy rates, and compensation as three key areas. This is really a way in which a state can better understand where there are workforce shortages, specifically within certain parts of of states. For example, when COVID-19 first started in early 2020, one of the top questions we received at PHI from states around the country were questions about to what extent were there available workers in certain parts of the state when a state would experience a certain hotspot. So, for example, in New York City, when the COVID-19 pandemic really exploded in New York City's hospitals and in nursing homes, there was an interest in figuring out, are there available workers in other parts of New York? The answer is we don't know, because most states do not collect enough data that would give that kind of precise information at the local regional level. Next slide, please. Another area is making sure that we rectify the structural, gender, racial, and other inequities that are facing direct care workers. We know that this is a workforce that is predominantly comprised of women, people of color, and immigrants. Also, 1 in 4 workers is aged 55 and older. So we're talking increasingly about older people supporting other older people. And yet what we also know is that these populations also experience additional challenges on the job that make it even more difficult to succeed in these roles and to really live economically well. Next slide, please. And this is important for a few reasons. One is that when we think about equity, it's both about ensuring that workers themselves can survive economically in these jobs and that they can survive across all of these populations, that this workforce is strong enough to support older adults and people with disabilities, and also that employers can meet demand. Of course, a more diverse workforce can also mean that, better efficiencies and stronger delivery of care is 2 examples. Next slide, please. Another area is making sure that we center direct care workers in leadership roles in public policy. Too often we see that policy interventions that are aimed at direct care workers, whether at the state or local or federal level even, do not include workers themselves as experts. And I think it's important that as we think about workers as the paid frontline of long-term services and supports in this country, they also have an opportunity to inform the public policy that's shaping their jobs. Next slide, please. Finally, I do think it's important that we shift the public narrative on direct care workers. Too often, direct care is inaccurately described as low-skilled work or as not real work, which couldn't be further than the truth. This is work that, of course, requires quite a bit of training, quite a bit of skill and knowledge. Also, too often, we see gross misrepresentations of women and women of color in these jobs, and I think there's ways in which we can really improve what people know and understand about these workers. And then overall, I do think that the general public isn't aware of the variety of challenges that I've described in this presentation. And so I think this is an opportunity to really shift the public narrative and devote public resources to educating different audiences. Next slide, please. One thing to note is that public narratives continue to harm direct care workers. One is that they render them invisible. Too often we see workers absent from the public discussion on healthcare and long-term care. 2 is that it's erroneously described as unskilled work, when in fact it takes quite a bit of training and skill and knowledge to do this work. And there's a fascination in the media about dangerous home care workers. So home care workers who are hired by older adults and people with disabilities and are threats in these homes and somehow end up exploiting them financially or even physically. These stories, of course, are true in the sense that they're being covered, but the fascination with workers as somehow dangerous or as a threat is what's a problem in the narrative itself. Next slide, please. Wisconsin, for example, has a career program where they have trained thousands of workers to become nursing assistants. And as part of the recruitment campaign for this program, they videotaped a number of existing nursing assistants to basically share what they love about their jobs and why they would encourage other people to learn to also join these jobs. And what this program has shown is that it's been incredibly successful in bringing more workers into this sector, and it's already being brought to scale in several other states around the country. Next slide, please. I will say that just a quick plug, 2 weeks ago, we did release a new report called State Policy Strategies, which are our recommendations for how to strengthen the direct care workforce at the state level. And we have about 24 strategies from around the country. It's available on our website at phinational.org. Next slide, please. Also, all of this information and much more is available on our website, again, at phinational.org. Thank you so much for the opportunity to present today, and I look forward to the conversation that follows.
Oh man, Robert, incredible information. Thank you for providing us such an overview of the direct support care workforce at a national level. I know there's a lot of questions, a lot of chatter, and we're going to get to that. And I know this is just a session that's so important for the community as a whole. So we were able to now from Robert get sort of a global perspective of the direct care workforce nationally, the issues, the critical topics. And now we're very lucky that we're going to bring it down closer to the ground floor here. And we're going to talk with the executive director of a provider, Kristen Pederson at the ARC of San Francisco, a parent of an individual who relies on direct support professionals, and who's Pat Hornbecker, the president of the ARC of California. And then also we're going to hear from a direct support professional herself about her interests, opportunities, challenges, goals in the profession, Tori Trentacoste. So I'm so excited that the three of you are here now to provide your perspective. And I believe that we are starting off with Kristen. So Kristen, I'm going to hand it over to you to provide your perspective as a provider and introduce yourself a little bit more if you like.
Great. Thank you, Jordan. And good morning, everyone. I'm excited to be here. This is such an important topic for all of us. I'm Kristen Pederson. I'm the executive director at the ARC San Francisco. We are one of the largest providers of direct support for people with intellectual and developmental disabilities in the Bay Area, and are a large employer, which is wonderful. I've been with the ARC for about 10 years, primarily in our workforce and education programs, and I'm now in the executive director seat. There's so much that Robert mentioned during his presentation that I'm furiously writing down. But I think when it comes down to it, particularly those of us that sit in leadership roles, is that our direct service professionals are the work, right? They are the most valuable resource that we have. It is critical that we are able to not only compensate and benefit those individuals well, but make sure that there are opportunities for advancement within direct service. There are so many people, and I look at it myself coming up that same sort of route, that the only way to develop professionally was to go into management, which is not everyone's interest. And I watch countless people choose not to go into management and work a second job so that they can stay in direct service. There are a variety of different things that I wanted to touch on today, but specifically because we're talking about statewide policy, I think there needs to be a really clear connection between any changes to minimum wage compensation and changes to the state contracts that we all hold. I'm sure, like many of you, this weekend I was approached to sign a petition for an $18 an hour minimum wage, which I wholeheartedly support. The challenge is there is no adjustment when minimum wage continues to increase. We happen to be running our business in the most expensive part of California. We're probably neck and neck with Los Angeles, but it's very close. And we are really hamstrung by competition with other employers, jobs that are low-skilled work, right? Working at Buffalo Wild Wings is low-skilled work. Being a direct service professional is not. We have highly educated, incredibly professional and passionate team members that work for us that are making a choice towards poverty, towards long commutes, living further and further away so that they're able to continue to do this work and do it at an organization that they believe in. And I feel like what that comes down to, and I know that often in these spaces, we're sort of preaching to the choir, but the undervaluing of people with disabilities gets sort of the ripple of that, the impact of that is the undervaluing of those who support them. right? That this is seen as jobs that are not complicated, jobs that are often invisible, although I think COVID has really highlighted the critical nature of this work, and jobs that really anyone could do. And it's just not true. I'm so proud of the diversity of how people come to us. You know, there's not a straight path in direct service work, but we know that we have many employees that are, you know, driving Uber until 2 a.m. I'm pretty tired at that 9 a.m. shift, or are making decisions to live further and further away and often relocating to another direct service organization because they're not able to afford to live in an urban area, which honestly provides the most resources for our participants. So there's this real tension around these roles. And, you know, philosophically, I really struggle, as much as I'm all about fundraising, I really struggle with the fact that we are supporting folks through state funded programming, and then we're ostensibly begging for money to fill the difference. We can't commit to our staff based on fundraising, and that's not a business model that works. So I think there are a couple of different ways that we can look at advocacy, really looking at braiding local, city, county funding with our state funding to ensure that we are able to compensate at a high level. These roles, you know, San Francisco, the living wage, and I would argue this, is about $24 an hour. Our average wage is about 19. So we have some real work to do. But I think there are opportunities, particularly within our local governments, to be reaching out when these changes happen to minimum wage, to be looking for partnership to fill that gap. Any city contract that we hold gets renegotiated every few years. That does not happen with anything that's Medicaid funded. So we are really looking for what are the creative ways that we can partner with different funding streams that are not private donors. Private donors are funding innovation, that are not private donors, to ensure that we are best supporting the members of our Bay Area community with disabilities, and that we're best supporting our direct service professionals. We are also working very hard on ensuring that there are opportunities for advancement, whether it's specializing in healthcare or job coaching or technology. We have so many direct service professionals who are looking for a ladder and really looking to build a career in direct service. And we want to make sure that we're able to offer those roles in a sustainable and honestly dignified way, that we are not counting on people working multiple jobs. We are compensating people in a competitive way. So we are competitive with the school district. We can be competitive with the city and other human service organizations. And right now, that is a real challenge. But I think COVID, with all of its challenges, has really taught us that there's a lot of flexibility out there. There are a lot of different ways we can look at things. We've been able to increase most of our staff to 40 hours a week. And I know Robert called that out of part-time work, that we have a lot more flexibility now. And so really looking to our funding partners to continue some of that flexibility so that we're able to best serve the workforce that we have and grow that workforce.
Thanks so much, Kristen, for that perspective and really, really great insight. I was listening intently. I'm going to hand over to you, Pat, and then we'll go straight to Tori after Pat.
Pat, you're on mute. Pat, do you see there at the bottom? You're kind of frozen a little bit on us, but at the very bottom, you should see the mute next to the camera.
All right, I think Pat's got some Wi-Fi issues going on there. We're going to work with her, but instead, Tori, we're going to jump to you from your perspective on this topic as a direct support professional and the clients I know that you care so much about and the work that you care so much about. Thanks for joining us. A little bit about yourself, please, the organization you work for, and the work you do.
Thank you so much for having me. I'm Tori Trentacoste. I am the program coordinator for UCPMB ODES in Sonoma County. I'm also the career path specialist for United Cerebral Palsy of the North Bay in Sonoma County. And I've been asked to talk with you guys about the future of direct support professionals. I did want to thank Kristen for painting such a beautiful picture of really what the issues are in direct support professionalism. You know, we do struggle a lot. You know, our love in our hearts is so much larger than our pockets. And we just appreciate them. And today I wanted to share my story of just why I do what I do and just the love I share. So I've been privileged to work with UCPMB for 7 years now. And I'll tell you, each one of those years just makes me love it ever much more. Over the years, I have been part of many changes throughout our company. When I first joined UCP, I was assigned as a leader in our community outreach program. This program was created because we didn't have enough space for our participants to be in, so we had to think creatively. And what that meant was that we took our guys into the community and we created integrating opportunities for them, volunteering and doing recreational activities and just allowing them to gain personal skills. And then we also, as part of my job, I networked with businesses in the community to create volunteer opportunities. So we were able to work with performing arts centers, and we adopted a park that we would clean. And this allowed our community as well as our participants to show what they were capable of doing. So over time, our employees have been able to build relationships with companies, and it opened up our participants' eyes to more career-focused possibilities. This also allowed our company to see the potential of our participants. Being able to build and understanding and implementing tools to better assist the companies in building work relationships with the individuals we support. It has been really rewarding, both for us, our participants, and the companies that we contract out with. So as we continue to move forward, as the career specialist, I was recently given this wonderful opportunity to change the future for our DSPs in a very large way. So our program is shifting from what was a day program with group work to a more person-centered planning platform where we are planning meetings with individuals. We are talking with them about their interests and helping them to schedule, activities and classes and work skill opportunities and workshops that will benefit them in the long run. I've got notes. So I want to talk about a little bit of the pandemic, just because that's kind of where we got our big jump. So during the pandemic, we decided to take an initiative and created a Zoom platform for all of our employees to utilize. This platform gave us and our employees the opportunity to attend educational and work skills centered classes. They were able to meet other participants and staff from all of our organizations. So it wasn't just my program, but our entire UCP family became such a larger proponent, and it felt like family to all of us. So in addition to these classes and all of these opportunities, they were able to pick their own schedules, just like they were attending school. And it allowed them to have that freedom and independence that we really want to push for. So I was offered the opportunity to become part of the HCBS program towards the beginning of last year. And when it launched, our participants, I started to look into the ones who were becoming a little more career focused. And I offered them opportunities to be part of that program. And as part of the program that we are running in our company, we participate in group discussions on a weekly basis. They attend career-focused classes that we do offer on Zoom. They meet in groups and they meet one-on-one, and they're able to talk to me as an individual, where we look at their interests, their weaknesses, and we help them build the support group that they need to succeed moving forward. So this program also allows us to meet, their needs as well as the HCBS needs, which we are trying to work on, where, we're out in the community 55% of the time, whether it's recreating, working, or volunteering, and we're doing our best to get them every opportunity to do such things. So more recently, we began planning our planning stages to successfully implement a new grant that we have just received through the HCBS program. Our participants are now going to be able to find individualized mentorships, doing jobs that they have interest in learning more about, or maybe they are hesitant on fully committing to. And so what this means is our employees have the ability to go and try out a job that they might want, but they're going to have a safety net that's going to keep them from being overwhelmed and feel that they have this, oh, what if I fail moment. And we want to make sure that they have, the support they need by giving them this mentorship that allows them to grow, learn the ins and outs of a job that they may show interest in, and they have the opportunity to do this as many times as they want for a minimum of 30 days and up to 90 days per mentorship. So it will help to, give them a better foundation, not only to make the participant more comfortable in the job that they may be looking into, but will also help the company that they may be looking into better basic training or job carving for more successful transitions of individual placements into our workforce in the community. So as we look into the future of what it means to be a DSP in this ever-changing field, we will continue to create opportunities and integrate our communities and support our individuals on whatever journey that they're on. Because in my program, we like to think that they have the ability to have a life without limits, and I believe that they deserve it. And I'm going to continue creating those opportunities for them every chance I get. Thank you.
Forgive President and parent. I love you.
Thanks, Tori. That was fabulous. I am now the bringing up the rear, as it were. I am the mom, and we live long and prosper is the theme for the day. And I would say that that's probably a good mom motto, because that's what we are trying to do. And I have to tell you of my son, Joseph, who's 41 years old. I'll have to schedule that face up in a few minutes. But I just want you to know that he has Angelman syndrome. He lives in his own apartment in San Francisco. It's a 2-bedroom apartment. He has a live-in companion and about 4 to 5 staff that rotate in and out around that wraparound services. His services are provided by the ARC of San Francisco. Thank you, Kristen. And we have a great team. I want you to know that when COVID hit, we sat down and had some strict protocols put down, which they did across the ARC. But I know in our apartment, that's what it was, from booties on feet to masks and gloves and cleaning every surface that anyone touched as they walked in and out. Why? because we had 4 or 5 people coming in and out of this apartment, and they were coming into contact with Joseph, but their other jobs took them into contacts with other participants in our programs and their own families. It's important to understand and the DSP heroes of this journey of the last years. They have been the dedicated stewards of people, which is what I prefer DSP to stand for. They have had to maintain their own bubbles at home. And we talk about bubbles. You all remember when we said, who are we filling ourselves with?
Dang, I think we're having some connection issues with Pat, but I know that she is, hopefully will be back with us and be able to share her passionate message as a mother for her son. I think what we're going to do now, maybe we'll bring Robert, Elizabeth back on. And I know we have several questions that have been a lot of chatter. And so maybe we can bring some of those questions up for our panel to discuss and talk about. Pat, you're back. I'm sorry I'll give you a chance to finish if you'd like as well. Hopefully it'll keep working. Why don't you finish up if you have, I know you have more to say. Yeah. Then we can go to questions. I'm glad you're back with us. Hopefully it works. Crossing my fingers.
I just wanted to talk about the fact, I just want you to know that we survived COVID very well because of what we had. We had 3 medical issues, but one of us took it to the ER, and I want to say thank you to the ER California for having advocated to make sure that people to the hospital with them. So I had his live-in companion be able to go with me, and we spent 9 hours.
Oh man, I'm sorry, Pat. So close, so close. Pat, maybe you could turn your camera off and just speak. That will help. Why don't we jump to some questions, and we're going to try to make sure Pat has an opportunity to finish up her great comments. But I know there's great questions, so the team will post some of those. I'll read them. Robert, as a parent provider, we aren't offering any training besides how to use the state's timesheets and rules on payment. How do we advocate for higher standards, even for parent providers, that the state invest in certifications as simple as CPR, working with people with ID and first aid?
Yeah, it's a great question. I mean, certainly the decision is at the state level. So I think trying to understand who, one, figuring out your state representative, but also Department of Health, Department of Labor. Oftentimes these workforce issues span different departments because they're covering aging, they're covering healthcare, and they're covering labor. So trying to figure out where the decision is being made and who can be your voice on these issues at the state level is critical. I also think that training is both, in terms of the arguments that work. I mean, one is making sure that, representatives and elected officials understand that good training benefits workers, it benefits consumers, and it benefits the economy. There's quite a few examples of the ways in which proper training can prevent costly mistakes, it can reduce hospitalizations, it can improve care, reduce turnover among workers, which can be expensive. Really understanding that cost-benefit analysis, I think, is an important piece of the argument. But the other piece is that I think that what we often find is that state representatives don't always understand the complexity of the entire long-term services and support system. And so understanding, who are the different providers in your area, how are workers and consumers connected, where is training happening and where is it not happening? We have found in many conversations around the country that sometimes people who should know where the training is and what needs to be corrected are simply not aware of it. So I think helping people give that primer, I think, is critical to that argument.
Thanks very much, Robert. Another question popping up. Kristen, how might you advise a provider to approach county officials regarding funding? I'm clueless.
Yeah, it's such a good question. So speaking of clueless, so are your county officials. So we're all in the same boat. What we have found in San Francisco, primarily through the grant making process for the city, is that we've had an opportunity to partner with Office of Economic and Workforce Development or the mayor's Office on Housing and Development to talk specifically about the support services that are needed for folks to enter the workforce and stay in the workforce, enter affordable housing and stay in that affordable housing. And so we've actually worked it into some of the contracts and grants that we receive from the city. I would also just start reaching out to your supervisors, particularly if you're living in an area where the minimum wage is higher than the state minimum wage. There's so much advocacy around minimum wage, as there should be, but it's one of those things where there are unintended consequences. And so talking to your local leaders about that compression, that now Burger King is paying more than you're able to pay your team members who are keeping someone healthy and safe, or supporting an individual to build their career or access post-secondary education. These are really skilled roles. And I think that cluelessness is kind of global because we are reimbursed by the state. It doesn't typically fall on their desk. So I would drop it on their desk and start meeting with folks as much as you can. And depending on your organization and how much bandwidth you have for fundraising, I would really look at what your city, what your county is putting out there around grant making, and see if that's also a way for you to kind of get in the door. And then someone else asked if we were unionized. Our DSP staff are unionized through SEIU. And so they do actually have more of a statewide voice, which I think is really helpful. So they're able to see things more globally as well.
Thanks, Kristen. I think we got time for definitely another question. We're going to give Pat the last word here. Robert, any surveys PHI is doing? I'm a parent provider and would love PHI to use me for their data collection. How can I help push policy?
We appreciate that, and I'm sure if you share your information with us, I can hand that to our research director. We're not doing any surveys right now. Most of our research is specifically with states that have contracted with us or through existing data sets, but we'll certainly take your contact information. Yep.
Great. And I want to give Pat an opportunity to have the last word here. Hopefully she stays off camera, may give her a chance to do so. And Pat, let's bring her back on and see if she has a chance to finish up. And if not, Elizabeth, I know that you often have comments about how you are supported. Anything you want to add?
I just want to say I agree with everything that was said. The legislators often don't know about our system. They don't know unless they have a family member who has a disability or who gets older and needs the support. And we need to keep knocking on their door, telling them we vote for you to get into the office so you can't forget about us, because we're very big and powerful community, and we belong at the table just like everyone else. Like Kristen said, if you don't pay a DSP what they're worth, it doesn't, it trickles down. It doesn't help the person that has a disability. We matter. We matter. And our workers matter, because they do it every day. And the state needs to see that. And I'm sorry, but anybody could flip a burger at McDonald's or Burger King. But it takes one hell of a person with a big heart to come into an agency and help people with disabilities thrive and see value in their life. And that's where the state needs to put the money behind it.
You rock, Elizabeth, as always, with those words. I want to thank this panel. This has been really an extraordinary topic and session and panel of presenters. You really kind of covered it from A to Z. A lot of comments and questions. So I also want to mention that this exact topic is what we're going to be advocating as a community for tomorrow, when we have the opportunity to take action tomorrow to talk about DSP wages and advocate for an investment from the state to raise the wages, especially right now when it's so difficult to hire. So I hope you're there tomorrow when we actually take an action together. So thanks everybody so much for joining us. You're incredible for the work that you all do. And I know that your contacts are shared as well for people to follow up with you. Thanks all.
Bye.